Mental health is always looked as taboo, and it shouldn't be. It's not. It should be right in there with our health. When you're not taking care of yourself, how are you going to take care of others? You need to take care of yourself.
It's just so imperative to take care of your mental well-being, especially on your days off, because you're just going to burn out.
Our physical and mental health are equally important.
We have to figure out ways of how do we gain back some of our wellness, mentally, emotionally, physically, spiritually, when everyone's feeling so depleted. We had the heat dome, the wildfires, the flooding, the landslides, the community evacuations, the recovery of bodies of children at sites of former residential schools. I mean, it kind of leaves your head spinning with everything that communities are having to deal with.
Everyone's running on fumes. We're, burnt out. And I think that was the kind of turning point for me, realizing that I had changed as a nurse and I had changed as a person.
It's hard to put it into words. I think it leaves me in some ways feeling a bit numb, to be honest.
Our collective experience of a number of compounding crises, these layered experiences affect people differently in different ways. So there's not one size fits all, but there is a need, I think, to reckon with how all of that impacts people within the healthcare system in profoundly different ways.
When you sign up to be in healthcare, there's a number of motivations, and often a motivation is to give, and so to be outwardly giving, often, sometimes, not always, but can come at a cost to your own well-being, your own health, right?
In the Emerge, it's not a place where traditionally we've had a lot of openness about talking about our feelings. Coping is highly prized and valued. And
we're not really trained to show vulnerability. We're not trained to acknowledge our own part or our fears. You have to kind of keep that public face on.
If we are to move through this and get to a place where we have an optimized and functioning healthcare system, including mental health and substance use care, leaders at all levels, not only within the system, we have to make space to recognize that the mental health impacts.
Being able to move forward from that involves people being honest with themselves.
We were a group of people that were, you're sort of mired in this sense of crisis and negativity that's everywhere around you, and you're trying to keep the boat afloat. And sometimes we do need to actually step back and remind ourselves that there are still really positive things about the work that we're doing. There are really good things, or else we do, I think, become a bit tunnel visioned on crisis.
The biggest thing we have is each other, right? I definitely have a good group of friends here that I work with, and my family that I can always talk to and kind of offload the way that I've been feeling or what I've dealt with that day. So we've all had lots to kind of deal with. But I feel like for myself, I've specifically been able to have them available and kind of offload, because they obviously know what we've gone through, and it's easier for us to kind of have that dialogue with each other.
Personally, I've learned that I need to make an ongoing effort to take better care of myself, so that I can show up as the kind of nurse that I want to be at work. And that has involved some hard choices, including switching roles at times, or taking a step back, or sometimes working less hours even when I know that there is need, so that I can still continue to show up. And that's something that still is a work in progress.
Relying upon individual resilience won't get us to the level of recovery we need. We need to create conditions of work, or conditions of practice, or conditions of employment where we have the fallback, we have the systems in place.